Welcome to the InfoMullet YouTube channel. If you enjoy this content, please like or share. And if you'd like to support the InfoMullet by becoming a mulleteer, visit us on Patreon. We appreciate your support. What is going on with other medical procedures? Okay, so every day in the US, there are people who are going in life-threatening conditions with heart attacks, strokes, serious end-of-life conditions. And the question is, what's happening to those with the rise of the COVID cases that is consuming the healthcare capacity in these places? Now, first of all, we've talked already, all elective surgeries have been pushed off. They've been delayed. They're kind of preparing for these surges to come. But you can't elect a heart attack later. If you're in a heart attack, you need to go. There's an article, I think it's from the New York Times. We aren't seeing those cases come in, and that's concerning. So doctors are talking to each other. It's not a study. It's kind of a more, anecdotal thing. But normally you would see in major metropolitan areas, you would see their measures. How many gurneys do you have lined up before the operating room? How many preps are you doing for these heart attack, stroke type situations? They're not seeing them come in. And that's concerning for two reasons. One, it may be that people are afraid to come into the doctors or the hospital with all of these warnings and the valid fear of contagion. They've already got something going on where they're going to be either immunocompromised or already have an underlying condition. Generally, the longer you wait to get emergency treatment, the worse your outcomes are going to be. The second is they may be having these situations and we're not catching it, and they're suffering the negative outcomes in their home. This is why we're not going to know the true sort of death count and impact of COVID until we can begin to understand what's going on in the apartments and homes of the people around us. This is why it's so important to have neighbors that can check in on you, or you can check in on them, or especially in these big areas, because the rate of decline in a stroke or a heart attack or even a COVID-related illness, if it's really bad, can be very, very fast. And if we're not getting emergency services, or people are thinking, I'm going to delay that call for an hour or two and see if it gets better, that can leave them in a very vulnerable position. So the answer is we don't know yet, but we know that those cases aren't coming in, or it doesn't seem like those cases are coming to the hospital. It's unlikely that we got lucky and no one's having heart attacks. They're probably still happening, but they're not getting the help they need. And that's going to be an additional impact. Thanks for watching the video. Hope you enjoyed it. If you'd like to follow the InfoMullet, visit us on Facebook or Twitter. And if you'd like notifications when we post new video content, click on the red subscribe button below the video. If you've ever wanted to become a mulleteer and support the InfoMullet, visit us on Patreon. We appreciate the support.